According to World Health Organization's 2022 report, 1 in every 8 individuals experiences mental health disorders. Globally, 970 million people experiences some form of mental illness. That's almost 1 billion.
According to the World Health Organization, mental health issues are becoming common across the globe.
Around 1 in 4 individuals experiences some form of mental health illness at some point in their lives. That's not just a small issue. It's affecting so many people around the world.
It's estimated that 1 out of every 4 people around the world suffers from mental disorders.
And you know what's even scarier? 14.3% of deaths worldwide are linked to mental health disorders. What's heartbreaking is that 70% of these people don't get any treatment. Can you imagine that? In India, millions of people are struggling with mental health disorders like Alzheimer's, epilepsy or migraines. In the United States, 57.8 million adults experiences mental health illness annually. That's nearly 1 in 4 adults. The WHO highlights that the neurological disorders contributes to 12% of all global deaths, with disorders like Alzheimer's and strokes leading the charge. To make matters worse, due to the COVID-19 pandemic worldwide, the number of anxiety and depressive disorders have grown.
Now the Wellbeing Trust is warning the impact of COVID-19 on mental health could kill another 75,000 people over the next decade.
Anxiety disorders grew from about 298 million people affected to 374 million, which is about a 25% increase. Close to 60 to 70 million people in India suffer from severe mental disorders.
India contributes much larger share by having today nearly 56 million cases of depression and another 41 million cases of anxiety disorders.
It is alarming to know that India is the world's suicidal capital with over 2.6 lakh suicidal cases in a year.
We have nearly 210,000 cases every year of suicide. That means nearly 700 cases per day. And for every suicide that takes place in India, there are 15 to 20 more attempts. I have to say it regretfully here that India has the highest suicide rate in the world today.
Statistics released by the WHO says that the average suicide rate in India is 10.9 for every lakh people. In a 2021 UNICEF survey, around 14% of 15 to 24-year-olds in India were reported feeling depressed or disinterested. These also include anxiety disorders, depression, bipolar disorder, PTSD, schizophrenia, eating disorders, etc. This is such a huge problem, yet most of the people don't even talk about it. This really makes us think how important our brain health is. Today, we are going to explore how brain health impacts our daily lives and why it is so important. Also, we'll discuss how AI can be integrated to neuroscience to make our lives more better. So, before we get started about neuroscience and brain study, let's see how everything started. In 1950, scientists identified the key neurotransmitters, that is the serotonin and dopamine, which laid the foundation of our understanding of how brain cells communicate. In 1980, the magnetic resonance imaging, that is the MRI, was introduced, which transformed our ability to study the brain without invasive methods. The NIH Intramural Research Program has been at the cutting edge of neuroscience research since 1949. When the National Institute of Mental Health was first established, followed in 1950 by the National Institute of Neurological Disorders and Stroke. Today, more than 180 laboratories spanning across 14 NIH institutes and centers explore the mysteries of the human brain. In the 1990s, the term cognitive neuroscience was coined, and new imaging modalities like fMRI was evolved. A Spanish neuroscientist named Santiago Ramon y Cajal, who was also known as the father of modern neuroscience, has made groundbreaking discoveries in the early 1900s. He proved that the brain is not a single mass but a network of interconnected cells. For this, he won a Nobel Prize. Now let's take a closer look at the current state of mental health disorders worldwide. One of the major rapidly growing disorders is Alzheimer's disease. Alzheimer's disease is one of the most prevalent neurodegenerative disorder, affecting over 55 million worldwide. And it doesn't stop there. It is expected to be doubled by the year 2050. affecting over 100 million people.
With currently over 55 million people living with dementia worldwide, dementia truly is a global public health concern, and not just in high-income countries. In fact, over 60% of people with dementia live in low and middle-income countries.
Alzheimer's is a progressive condition that affects memory, thinking, and behavior, and it's currently the 7th leading cause of death in the world. Recently, the actor Chris Hemsworth discovered that he had a genetic disposition to Alzheimer's, which made him 8 to 10 times more likely to be diagnosed with the disease.
You have a very rare combination, which is you have 2 copies of ApoE4, a set from your mom and a set from your dad. You have an increased risk of Alzheimer's disease.
How much higher?
Probably somewhere between 8 and 10 times higher than that of someone in the general population.
And the scariest part of this disease is that the early symptoms are often ignored, and the diagnosis is made once a significant brain damage has already occurred, making it more challenging to treat. Next is epilepsy, marked by recurrent seizures affecting over 50 million people worldwide.
We use the word epilepsy to show that there's a predisposition for patients to have more than one seizure. But what people don't realize is over 3 million people in the United States have epilepsy, with 150,000 new cases per year. But to boil that down, 1 in 26 people will develop epilepsy at some point in their lifetime.
Despite of high prevalence, epilepsy is still highly stigmatized. Many people with epilepsy faces discrimination, both socially and in terms of healthcare access.
It affects them physically with seizures, sometimes with side effects from their medication, but emotionally there's isolation, there's stigma. There actually was a national survey conducted by SK Life Sciences that found that patients with epilepsy and their caregivers, about 3 out of 4 of them, struggle to feel normal, living in constant fear of when their next seizure will come. And 80% of them say that they feel very isolated. And that actually leads to issues with relationships, socially, with jobs. So in fact, patients will say that 50% of them are limited by what job that they can get, and many of them have even lost their job because of seizures.
Epilepsy is one of those brain conditions that can greatly affect people's lives. Next, there is migraine, which we dismiss as just a bad headache.
And sometimes we think about the migraine as just the headache. One really goes well beyond that. Migraine is the type of headache that typically affects one side of the head and oftentimes are associated with nausea, vomiting, light sensitivity, sound sensitivity, smell sensitivity.
Migraines affects 1 billion individuals each year and is one of the most common neurological disorder with high prevalence affecting young adults and women.
I always noticed being sensitive to light and sound.
I'm having difficulty speaking, I'm having difficulty concentrating.
Feels as though someone is stabbing me in my eye with an ice pick or a knife.
I get a lot of nausea. I kind of have to tie something around my head because I feel like my head is going to explode.
The WHO recognizes migraine as serious neurological disorder as they can severely affect work, social interaction, and overall quality of life. In fact, about 12% of the world's population suffers from migraine, and it is 3 times more common in women than in men.
If someone does have a migraine, I do encourage them to get care from their provider, their physician, because they might be able to get treatments that are very effective and very quick.
Aside from these conditions, there are also numerous other neurological disorders like Parkinson's disease, multiple sclerosis, and stroke that continue to affect millions. Parkinson's disease affects nearly 10 million people worldwide. Stroke is the 2nd leading cause of death, which affects around 15 million people every year, with 5 million people of them suffering from permanent disability. These conditions are on the rise due to the lack of awareness and treatment options in many regions of the world. By this, we can see that the mental health is not just a small issue, it is a global health crisis. The statistics are shocking and the consequences are real, affecting friends, families, communities, and the entire nations. But there is still hope, about which we'll discuss later in this video. But first, let's discuss the hurdles and challenges faced by both patients and healthcare professionals all over the world. One of the primary challenges is stigma. Many people still look at healthcare disorders as something to be ashamed of.
In our society,
mental illness is stigmatized more than any other illness or condition.
Another challenge is the complexity of the early diagnosis. Neurological disorders like Alzheimer's and Parkinson's are often diagnosed only after a particular brain damage has already occurred, which makes it more difficult to be treated.
Early diagnosis allows us to diagnose patients at a milder, earlier stage of disease, so they're not as sick. And there's no question many diseases respond better to treatment once they're diagnosed earlier, milder rather than more severe. If you diagnose people earlier, you get them onto appropriate therapy, and you can definitely work harder to improve their survival and their quality of life much better sooner.
Then there is lack of effective screening methods for the diagnosis of neurological or mental health disorders. And even after the diagnosis is done and a particular disease is detected, the next challenge is treatment of the disease. For many neurological disorders, including the Alzheimer's and Parkinson's, there are still no cure. There are just treatments to manage the symptoms. Also, the availability of these treatments depend on where you live. In many low and middle income countries, does not even have basic treatments available there. Only 40% of people with neurological disorders are getting appropriate care. And lastly, there is financial burden. The cost of consultations, diagnostic tests, and ongoing treatments can be huge. According to the Alzheimer's Association, the global economic impact of dementia is estimated to be $1.3 trillion annually. So as we can see, there are a lot of barriers that comes in between a person and the care they need. The lack of awareness, stigma, the complicated diagnosis, the early treatments are all the challenges that are faced by the healthcare systems all over the world. But the good thing is, a lot of advancements is being made to make these things solvable. The advancements in the artificial intelligence and machine learning is making it more easier for the patients and healthcare professionals to make early and accurate diagnosis.
AI can actually save lives and improve healthcare for millions of patients around the world. AI is helping us personalize the delivery of care, make hospitals more efficient, and improve access to healthcare by providing accurate decision-making tools.
Artificial intelligence is shaping the medical industry. Nearly 80% of U.S. healthcare organizations are already using AI, according to a recent report.
The use of wearable devices is making it easier to monitor the conditions like epilepsy and migraine in real time. One of the most groundbreaking advancements is the brain-computer interfaces.
Some kind of brain-computer interface.
A brain-computer interface?
Yeah, at the neuron level. So this is sort of intelligence augmentation as opposed to artificial intelligence.
Right.
BCIs allow for direct communication between the brain and external devices. They have shown huge promise in helping the patients with paralysis and stroke to regain lost functions. Take Neuralink as example.
In January, Elon Musk announced his company Neuralink had successfully implanted a chip in a human.
Neuralink, co-founded by Elon Musk, is an experimental implantable brain-computer interface, or BCI, a chip surgically implanted by a robot and connected by threads to a patient's brain that allows the patient to control a computer or smartphone with their mind.
This is all from there to there. Yeah, man.
They are developing an implantable device that can read brain signals and potentially help people regain lost motor functions. Though still in the early stages, this technology could one day provide significant help to individuals with conditions like Parkinson's or spinal cord injuries.
What can you do now with the chip implanted that you could not do prior?
I can control a computer just like anyone else can, which is not something I was able to do beforehand.
You just played some music?
Yeah, man.
That's awesome. Do you worry because you are the first patient that something unforeseen could go wrong now that this is inside your head?
I wouldn't say worry. It was something where I knew that if I did this, then it would take a lot of headache and heartache away from the people down the road.
In addition with BCIs and wearables, telemedicine is also helping a lot with the neurological conditions. Through telehealth platforms, people can now consult neurologists remotely, get second opinions, and have their brain scans analyzed by specialists from anywhere in the world. This technology helps a lot to the people who lives in the places where healthcare professionals are not available.
In rural areas, for example, local clinics, they're using AI-driven tools to help diagnose patients remotely. That means that patients are connecting with specialists without even needing to leave their community. That's a game changer.
We are also seeing the integration of artificial intelligence and big data in the mental health research. So what does all this mean for the future? We are seeing a lot of successful case studies and real-world applications that are making a huge difference. Whether it's AI apps for mental health, EEG wearables for mental health disorders, or BCIs for stroke recovery, we are seeing a great shift. I hope this video gave you a brief understanding of how important the brain health is, and also how artificial intelligence, BCIs, and telehealth are improving the brain care.
Just like we need to care for our bodies, similarly we need to care about our minds and our hearts.
And that takes courage, because mental health and well-being can be difficult to talk about openly.
Every time a person has a conversation about their mental health, it encourages the next person to speak about his or her mental health.
So let's create that change, one conversation at a time.